Now, returning to election issues, and the number of South West families forced to sell homes to pay for care has escalated in recent years. Across the country, it's been estimated at nearly 1,000 a week. The South West, of course, has a higher proportion of pensioners than any other region. So the question of paying for the care they may need is an important one for all of us here. Our health correspondent, Sally Mountjoy, reports.
Hello!
Anne Ellis is a home carer and a lifeline for Vera Luckham. At 101, the former publican still has a ready wit, but can't get about. So 3 daily care visits to help her dress, wash and eat, keep her where she wants to be, at home.
I'm quite happy, quite happy. As happy as one could be under the circumstances. I'm very happy.
And that's really because you're under your own roof, would you say?
Oh, yes, yes.
I just adore this job that we can keep the people, at their own homes, which is their choice.
Because Vera's needs are high, Devon Social Services pay her care bill. But although Somerset still supports those with moderate needs, other South West councils only provide free help to people with substantial or critical needs. The trouble is people are living longer and society can no longer afford to look after everyone in old age. And the challenge is greatest in the South West, where 1/5 of the population is 65 or older. By 2025, 1/4 of people in the region will be pensioners.
Hello, Mum.
Since a stroke 5 years ago, Pat Drayton's lived in a nursing home in Somerset. Her 3 children have had to sell their parents' house to pay the fees. Their father Charlie died a few years ago. He ran his own building business and always wanted to leave something to the next generation.
He was very much a man who was motivated by family, and he would have wanted to hand it on to the grandchildren so that they could have university education and get a good start in life. So I think he would have been really quite disappointed to have seen this situation.
If you can't pay, the council will fund your care home fees. But if you have capital of £23,000 or more, you'll have to pay in full. Less than 23,000 but more than 14, and you still have to contribute to the costs. Organisations like Cheselden Continuing Care help families like the Draytons try to claim care costs on the NHS. But some estimate nearly 1,000 families a week are having to sell homes, and it's the sense of unfairness this has created that made the funding of social care a bitterly fought pre-election issue.
Are you going to do a levy? Rule it in or rule it out?
Labour would have an NHS-type national care service with free care but compulsory contributions. An independent commission would decide how to do this.
The right answer for the future is to provide social care on the same basis as we provide NHS care, so free at the point of use, according to people's need, not ability to pay. But to create such a system, that will mean everybody contributing and paying into the system. We want people to give people choice over how they pay.
The Liberal Democrats too want a cross-party commission, but abandoned a pledge of free care for all as unaffordable.
The Lib Dems favour a partnership approach whereby the state contributes to the cost of care based on need, irrespective of your income. But we recognise there is a problem in funding it because of the state of public finances. That's why we argue that all of the parties have to come together. We have to get more money into the system to provide the quality of care that older people need. But we need to together find a solution.
The Conservatives plan a voluntary insurance scheme where £8,000 paid on retirement covers future care home needs. A top-up premium would meet home help costs.
1 in 5 people go into long-term residential care, and then they would lose everything. Their assets, their house, it all gets sold. And we have to arrive at a point where that does not need to happen. And so, through our home protection scheme, offering people an upfront opportunity to pay an insurance premium of about £8,000, we can then give people the peace of mind as well.
Finding a fair and affordable way to look after older and vulnerable people will be one of the next government's toughest challenges, but one that all parties now agree must be tackled urgently. Sally Mountjoy, BBC Spotlight, Somerset.